Alright, so we will be learning about endocrine disorders. I will try to cover as many disorders as possible, but I will be majorly focusing only on the disorders that have been mentioned in the first year MBBS journal of India. Alright, so we will be focusing on four major disorders. We have pituitary gland disorders, thyroid and parathyroid disorders, as well as adrenal gland disorders. Starting with the pituitary, it releases a growth hormone, and growth hormone is released by acidophilic cells. These are basically cells that are attracted towards acid exchange, which is why it's called acidophilic. Similarly, we also have some basophilic cells which are attracted towards base exchange. So the acidophilic cells of anterior pituitary, they secrete growth hormone. So the disorders of growth hormone can be categorized in general in two different ways. We have disorders caused by increased growth hormone and disorders caused by decreased growth hormone. So if it's decreased, we simply have dwarfism. If it's increased, then it actually depends on whether it's happening in the adulthood or childhood. Now, what's the difference? So we have this epiphyseal plate in the long bones of everyone, and these epiphyseal plates are responsible for the growth of the long bones, which obviously gives you increased height. Now, what happens in adulthood is around the age of your early 20s, your epiphyseal plate it undergoes a fusion, and once that is done, the long bones they cannot grow anymore. So if the long bones can't grow anymore, then even if you inject it with growth hormones, they are not going to really change their size. So there will be a clear difference if someone whose epiphyseal plates have been fused and then the growth hormone has been injected. That will have a clear difference in the characteristics compared to someone whose epiphyseal plate has not been fused. So we can either have growth hormone which is increased before epiphyseal plate is fused, which is since childhood, that is called gigantism, or we can have a disorder in which the growth hormone is increased after the fusion of epiphyseal plate. So this happens in acromegaly. Okay, so for gigantism, we will typically have someone who is like a giant. Okay, so we will look at some features of it. Since the long bones can grow a lot, the person will have a very tall stature. They will also have increased skeletal and muscle growth. Along with this, they will also have hyperglycemia. So hyperglycemia is happening partially because your muscles and bones require glucose to grow in size, and also because your growth hormone itself can lead to increased glucose in your blood. Along with this, your growth hormone, if it's increased, it can act through your liver and through something called somatomedins, and these can cause some sexual problems like gynecomastia and loss of libido. Now, in general, whenever your growth hormone is raised, whether it be at childhood or adulthood, normally what would be the cause? The cause mostly would be some pituitary tumor. So if there is a pituitary tumor, you can imagine this pituitary tumor to grow in size and eventually obstruct the optic chiasm. So a very late feature of increased growth hormone disorders is a disturbance in your vision. All right. So now let's look at acromegaly. So in acromegaly, what we have is that the long bones are fused, so the person won't really grow in size anymore. Instead, their central bones, they will have very distinct and huge features. And all those features are actually visible on this picture. So first of all, we will have a prominent brows. We will have some prominent supraorbital ridges, which are basically those ridges above those brows. We will have a broad nose and large lips, and we will also have these large and protruded jaws. It's called prognathism. All these together are called the acromegalic facies. Okay, along with this, you'll also have kyphosis. Why is that happening? It's happening because your spine, being a central bone, it can grow, because of the growth hormone, but your long bones are not growing, so your height is the same. Since your spine is getting an abnormal growth, a curvature forms, and that is kyphosis. Along with this, there will also be hyperglycemia because growth hormone can directly cause increased glucose levels and visual disturbances, which we already discussed. Now, how will you diagnose this disorder? So, you can either have a lateral X-ray of the head, MRI of pituitary gland, or CT scan of head. These are the radiological things that you can do. In this, you will actually basically find some abnormality in the pituitary gland, or you can do plasma levels of growth hormones, which is a blood test. Okay, now let's look at dwarfism. So the dwarfism is the opposite of gigantism. Here, the growth hormone is decreased since childhood. There will be a short stature, there will be reduced skeletal and muscle growth, which is again happening opposite to gigantism. There will also be shortened hands and feet, but a large head. Now, why is the head large? Basically, the head is a normal size. It is not really getting affected. So compared to the body, it will be larger. And there is no mental retardation. Why are we talking about no mental retardation? This will be important later on when we talk about cretinism. Because cretinism is quite similar to dwarfism morphologically. But the difference would be that in cretinism, there would be mental retardation, and in dwarfism there would be no mental retardation. There won't be any problem in reproduction either. Okay, so how do you diagnose it? You can record the child's height. If the child's height is not increasing in their childhood and teenage, then that is a very good sign that the child might have dwarfism. You can do X-ray of hands and wrist for the definitive features, and obviously the plasma levels of growth hormone will be decreased. Okay, so that was pituitary gland. Now let's look at the thyroid and parathyroid glands. So again, it can be increased or decreased. There are actually many disorders for increase and decrease thyroid hormone, but we will be only looking at some of them. Again, the ones which are mentioned in the first year journal of MBBS students from India. So for increased, we have Graves' disease, and for increased, we have Cretinism and Myxedema. Cretinism, it happens since childhood, and Myxedema, it happens in adulthood. Okay. So what is Graves' disease? It's also called toxic goiter or exophthalmic goiter. Why toxic goiter? Because in Graves' disease, the thyroid gland is very hot. It's hot in the sense that it's actively producing thyroid hormone and it is enlarged. It's also called exophthalmic goiter because of a very prominent feature, which is that the patient's eyes might be bulged out, and we call that exophthalmic. The Graves' disease is a form of autoimmune disorder, and in this there are basically your body will create antibodies against thyrotropin receptor. It's a receptor inside your thyroid gland, and if there are antibodies against it, then they will go and irritate these receptors, and these receptors will start acting up and releasing and basically starting the entire T3 T4 T3 thyroid hormone genesis and all. That will lead to a lot of thyroid hormone in your blood basically, and that will lead to hyperthyroidism. So yeah, if these antibodies attack your thyroid gland, you will get hyperthyroidism. If they attack your back of the eyes, it will lead to these exophthalmos. Okay, so we have the hyperthyroidism. The features of hyperthyroidism, it's not difficult to memorize them. If you picture it like a sequence or in the form of in a systematic manner, then it will be easier for you to remember. So we will look at the basic features of hyperthyroidism, and we'll look at the system-wise features of hyperthyroidism. So the very basic feature is that the thyroid gland is responsible for metabolism. If there is too much thyroid hormone, then the metabolism is increased. If there is too less thyroid hormone, then the metabolism is decreased. Now, what is metabolism? So, a simple way of looking at this is metabolism is how efficiently your body is burning energy. If your body is not burning energy very efficiently, it's called a very high metabolism. If your body is burning the energy very efficiently or is not burning at all, then it's called low metabolism. So what happens in high metabolism? In high metabolism, your energy is getting burned unnecessarily and very inefficiently. So a lot of heat is produced and a lot of energy is wasted. Since there is a lot of heat produced internally, the patient will have heat intolerance externally, which is he will complain that he is feeling hot when others are feeling cold. He will also have excess sweating and he will have a lot of weight loss because all the energy is getting burnt. Now let's look at the system-wise features. In CVS, we will have high blood pressure and tachycardia. In the GIT, we will have diarrhea. In the CNS, we will have nervousness, irritability, and insomnia. Along with all this, we will have an enlarged thyroid gland. It's a very active gland, so which produces thyroid hormone very actively. So, which is why it's called the toxic goiter. Now, if the antibody attacks other places, I already discussed about parodic eyes. It's called exophthalmos. But your antibodies can also attack the skin near your tibia, very characteristically around near your tibia. So that's called peritibial myxedema. Okay, how do you diagnose it? You can do radiological things like ultrasound, CT scan, MRI. Along with this, you can do something called radioactive iodine uptake. What is it? You basically give the patient a radioactive iodine. We are giving radioactive iodine because radioactivity can be captured through special lens and cameras. So this iodine will be taken in by the thyroid gland for production of thyroid hormones. And using the special camera, we can monitor how much iodine is being uptaken and all. And other than that, we can do some blood test. And the blood test will find there is high T3 and T4 levels because it's a toxic goiter. And that will lead to feedback inhibition, because of which the TSH levels will be low. One thing to notice, the radioactive iodine uptake, it should not be done in pregnancy. Obviously, because radioactive things are in general dangerous for people, and it is even more dangerous for the newborn baby that is being developed in the pregnant lady's belly. So, all the more reason why you should not do anything related to radioactive stuff in pregnancy, including X-rays as well. X-rays are usually done with abdominal shield if at all you have to do in pregnancy. Okay, so we looked at the increased thyroid hormone. Now let's look at the decreased thyroid hormone. We have cretinism and myxedema. So starting with cretinism, it happens since childhood. The reasons for happening, it is actually related to the pregnancy. If the pregnant mother has some deficiency in iodine, or if she is taking antithyroid medications, do note that not all antithyroid medications cause this, but some of them definitely do. Even if she has anemia or she is smoking, all of this can cause cretinism in the newborn child. What are the features? We have growth retardation, which is actually quite similar to dwarfism, which is why, if you remember, that we mentioned in dwarfism that it has no mental retardation, because that point will be relevant now. Because in cretinism, there will be mental retardation and developmental delay, and obviously there will be hypothyroidism. Okay, you can actually imagine it as all retardation of growth, retardation of mind, retardation of thyroid. Okay, so in cretinism, we'll be discussing these features now in detail. So for growth retardation, the features will be similar to dwarfism. Along with it, there will be a lack of weight gain, poor feeding, bone abnormalities, and muscle weakness. If the muscle weakness happens in the abdominal area, then that will lead to umbilical hernia. There will also be sexual retardation. And if you remember, in dwarfism, we discussed that there is no sexual reproductive problems as well. Again, that was to contrast it with cretinism. Next, there will be some mental retardation and delayed milestones. One of the milestones is the baby crying, so there will be very little crying. Then we will have some features of hypothyroidism. Now, the features of hypothyroidism, it's not difficult to memorize it. You just have to imagine this as the opposite of hyperthyroidism. In hyperthyroidism, we had high basal metabolic rate. So in hypothyroidism, we'll have low basal metabolic rate. There will be cold intolerance, which is that the patient will complain that they are feeling cold when others are feeling hot. There will be excess weight gain. In the CVS, again the opposites. There will be low blood pressure and bradycardia. In GIT, the opposite of diarrhea, which is constipation. In CNS, the opposite of insomnia and irritability is fatigue and excessive sleep. Along with this, there will also be a floppy muscles and dry skin, as well as enlarged thyroid gland. Both hyper and hypo has enlarged thyroid gland, The difference is in hyper, the thyroid is actively producing thyroid hormone. In hypo, the thyroid is not actively producing thyroid hormone. All right. So, cretinism, how do you diagnose it? How do you what diagnostic test do you use? It can actually be some tests can be done on the mother, which is called antenatal screening of the mother, and that is really useful because cretinism is actually a preventable cause of mental retardation. It is actually one of the only preventable causes of mental retardation. So, if the mothers are properly and thoroughly screened before giving birth in their antenatal period, then you can actually completely prevent cretinism. Okay, so the other methods we have to diagnose cretinism is through technetium thyroid scan, which is something similar to the radioactive one only. Then we have the radioactive iodine test, and then the blood test. Obviously, there will be low T3 levels, T4 levels, which will cause feedback activation of TSH, so high TSH and thyro binding globulin. Okay, so yeah, only cause of mental retardation that is preventable. Okay, now let's discuss myxedema. Okay, so in myxedema, this actually uh, happens in adulthood, not since childhood, in adulthood, and it happens to those cases of hypothyroidism in adulthood which have been undiagnosed, untreated, unnoticed, and it have got worsened, and worsened. So now there are many causes for hypothyroidism, which we are not discussing here, but all these different causes can eventually lead to myxedema in adulthood, and that is what we are going to discuss. Okay, so a classic feature of myxedema is that there will be deposition of myxedematous tissue on skin. Okay, so which will obviously lead to skin changes, which is what we can see in this picture, and actually it's the same picture through which you can identify and memorize all the features of myxedema. There will be dry hair, there will be periorbital edema, puffy or dull face, dry skin. Okay, these are the features that you can memorize. Along with this, there will be hypothyroidism, which we have already discussed. So please refer that. If it is not treated still, then this can become so severe that it can lead to coma or death. Okay, there are many possible tests for myxedema, not just what I've shown just now, but that all depends on the underlying cause of hypothyroidism. Now, hypothyroidism itself can have many different causes, so I'm not going into that. I'm only going to talk about myxedema. So one common test for all those causes of hypothyroidism is that there will be low T3 T4 levels, which will lead to high TSH and TBG levels. Okay. So we discussed thyroid gland. Now time for parathyroid gland. Okay. So parathyroid is responsible for calcium metabolism, and if some decrease or increase happens, that will lead to some decrease or increase in calcium levels of the body. Okay, and if the parathyroid hormone, if it's low, then that will lead to hypocalcemia. And whenever calcium is low in blood, there is a very classic feature called tetany or carpopedal spasm. Why does this happen? Yeah, one of the most common causes actually accidental removal of parathyroid gland during thyroid surgery. So we discussed about hyperthyroidism and hypothyroidism, in which the thyroid gland can grow quite big. If it is too big, then one of the only options is to surgically resect the gland. And sometimes in those surgeries, the parathyroid glands can also get resected. Now, this is often a complication of the surgery, and that is always discussed with the patient before doing the surgery. And the patient is informed about this problem, about this complication, about this risk. They are told that this surgery has certain complications, certain limitations, and your parathyroid gland getting resected is one of the risks and one of the complications. Only after the patient has assessed this risk thoroughly and agreed for surgery, only then the surgery is done. So it is not like, surgeons are at fault for doing this. It's not like that. It is just a complication of the surgery which can or cannot happen irrespective of the surgeon's skill. Okay. Obviously, the skill is higher, then the risk is much lower. All right. So now what are the tetany or carpopedal spasms features? So the main feature is actually what you can see in the picture itself, which is a flexion at the wrist, flexion at the metacarpophalangeal joints as well. but you can see a clear extension of the interphalangeal joints, and you can also see the thumb, which is opposing the other fingers. That's called opposition of thumb. Along with these features, you will also have some numbing or tingling sensation. This is happening because the calcium levels are quite low. That is making your nerves hyperexcited. Okay, we have two different tests for diagnosing it. One is called the chopstick sign, which is that if you tap the skin that is covering the area of your facial nerve, which is actually mostly the skin of your cheek right in front of your ear. If you tap it, there will be some muscle twitching, and that will be visible. This is called the chopstick sign. Then we have the Trousseau sign. Trousseau sign is basically you take your baby machine. Its cuff is called sphygmomanometer, and that cuff you tie it on your hand and you apply pressure. Then what will happen is that you will notice some muscle spasms. Okay. Along with this, we can do some blood tests. Obviously, the serum calcium levels will be low, the parathyroid levels will be low, and serum phosphate levels will also be low because parathyroid hormone is also responsible for its metabolism. Okay. So we discussed pituitary and thyroid as well as parathyroid. Now let's discuss adrenal gland. Okay, so in adrenal glands, we are going to discuss two disorders: the Cushing syndrome and Addison's disease. Cushing syndrome happens when certain hormones released by the cortex of your adrenal gland. Do know that adrenal gland itself is quite complex. We have medulla and cortex. So we are talking about the cortex here. The cortex itself releases many hormones. We're specifically going to talk about cortisol that is released by the cortex. So when the cortisol levels are too high, that is what causes Cushing syndrome. Now, one more thing to notice, it doesn't have to do something necessarily with the adrenal gland, because there are many different ways Cushing syndrome can arise. So we'll be discussing those first. Okay. So first of all, it can be a adrenal cortex tumor, which is causing too much cortisol levels, but it can also be a pituitary tumor, which is releasing the ACTH, adrenocorticotropic hormone, and this is stimulating your adrenal cortex too strongly, and that is leading to lots of cortisol. It can also be, ACTH that is released from elsewhere in your body. For example, paraneoplastic cancers that release ectopic ACTH. Now, what are the examples of paraneoplastic cancers? We have the small cell carcinoma of lungs, squamous cell carcinoma of lungs. So yeah, this happens in smokers, by the way. So paraneoplastic cancers can release ectopic ACTH, which can also cause Cushing syndrome. It can also be a hypothalamic tumor. Hypothalamic is the boss of everything, and that releases CRH hormone that can stimulate your pituitary to release ACTH, that can stimulate your adrenals to release cortisol. Even long-term use of glucocorticoids and steroid abuse as well, which is the favorite question for USMLE and lab and all. They will give some gym rat or sports person in the question, and most times that person is abusing steroids, and most times they will have Cushing syndrome or something similar. What are the features? First and foremost, we have to understand what is the function of cortisol. Cortisol is responsible for the metabolism of glucose and sodium. Okay, so there will be very high levels of glucose and high levels of sodium in the body when cortisol is high. So when glucose is high, it's called hyperglycemia, and when sodium is high, there will be fluid retention. That's called edema. Now, the other thing you have to note is when there is hyperglycemia, which is a lot of glucose in your blood, it will go and deposit into your central area, which is your face, your neck, and your back, and your tummy. Okay, so if it's deposited in your face, it's called the moon face. If it's deposited in your tummy, it's there'll be the classic belly, pot belly that is seen in these patients. Do note that these features can also be seen in diabetics because they also have hyperglycemia. So this can also be seen in diabetics. Along with this, there can be a camel back hump, and also there can be some double neck and all, increased fat deposition in the neck. In the males, there can be some deposition around the chest area leading to gynecomastia. Okay. Now, if there's too much sugar in your blood, that can go and attack your white blood cells and get deposited in there. And your white blood cells, as a result, can die quicker, which can make the person susceptible to infection. This is also a mechanism that is noted in diabetics. So it's the same mechanism over here. Cortisol is also responsible for connective tissue, bone, and muscles development. So if it's too high in connective tissue, you will find very thin skin with purple striae and bruises and petechia. In bones, you will notice some osteoporosis, which is basically it increases the turnover of bones. So since bones are getting destroyed too quickly, rather than getting produced, it leads to osteoporosis, and there will also be the extremities. In females, the notable symptom is amenorrhea and hirsutism. Along with this, also notice that there can be some amount of CNS irritability and personality changes, but it's not too significant. How do you diagnose it? You will have you can do serum cortisol levels, which will be quite high, plasma ACTH levels as well, and routine urine investigations as well. And in fact, these diagnostic methods goes quite deep. There are many deep diagnostic methods in this to see whether it's pituitary ACTH or ectopic ACTH, or if it's because of adrenal cortex tumor. It's actually a very vast topic. Maybe I can cover it some other time. If any of you are interested, do comment that below if you are interested in me covering that topic. And that is quite high yield for USMT and PLAB exams as well. Okay, so let's also have a brief look into the reasons. This is not too much though. So this happens because the adrenal hormones are low. So the notable features that you can see immediately is hypoglycemia, the opposite of Cushing syndrome. Hypoglycemia will lead to weight loss. Okay, and you can also see because of weight loss that person is a very old and fragile person. Also do note that there can be some changes in the body distribution, which is why mustache is drawn over there. And there can be a bronze pigmentation of skin as well. There's something called adrenal crisis, which is profound fatigue, dehydration, vascular collapse, renal shutdown, where sodium is completely depleted and potassium is too high. And if potassium is too high, it leads to arrhythmias. Okay, so this is happening because adrenal hormones are closely linked with the regulation of your blood pressure, as well as the regulation of mineral exchange in your kidneys. So if adrenal hormones are absent or suddenly they disappear, that can completely cause problems in your blood pressure as well as the mineral exchange. That's it. Thank you. If you like, then please do subscribe, please comment, and please like the video, and please share it among your friends as well.